Hi, I'm Dr. Nithya. I'm an orthodontist. So I did my PG from GDC Shimla. So today I'm going to give you two tips. One is why to choose ortho, and another one is what you have to do after taking ortho as your PG, and some tips after you take ortho as your PG. So one thing is why I chose was that ortho cannot be done. It cannot be done by a general dentist. It cannot be even done by anybody who's even taken a diploma courses, because it requires a very good expertise and skill, which is the mastering that is required for the 3 years of the PG life. So even a diagnosis treatment planning cannot be done so easily by anybody else other than who has done a real thorough mastering as the MDS in orthodontics. So I would say it's a very unique specialization. It's going to impact a person's face, the smile and everything, which is very important for anybody. So it's a very good thing that it keeps going, because it has no end. Everybody loves their face, their smile and everything. So it has no end, right? So it will not go down so easily. So that was the main reason why I took ortho. So the next thing is what you have to do after taking the PG in orthodontics. What I would suggest you as a tip is that you have to take risks, because if you are only doing what your staffs say for a patient, for example, for a patient you're changing wire and etc. So if you do only what your staff says, that's going to be like a blind thing what you will be doing from what they say. But what I would say is take risks, take unique cases, do a very important case selection, because whatever cases you're going to take, it is going to make you learn from upside down totally. So you have to take very good variety of cases and difficult cases, and you should not be afraid to take those cases. You should be like very happy to take difficult cases, and you have to learn about those cases. You should read articles and textbooks. You have to go through regarding your case especially, and you should try to get the treatment plan by yourself. If you have some doubts, you can take the help of the specific professors or assistant professor, whomever you are comfortable with, or whomever is very good in teaching, or even HODs. But I would say you have to do mistakes and you have to learn, because when you're going to choose a specific article based upon your case and you're going to read about that, you're going to know what the other person has done on that. Slowly, when you do this for every case, you will get new ideas popped out. So this is how you build or you create new things, new biomechanics. You create new treatment planning itself for a patient. So that is how your uniqueness will come out. That's one important thing. And I would say that you have to do mistakes and take transfer cases very seriously, because I did that and I learned a lot of things from my transfer cases. I learned what I should not do from my transfer cases, because there would have been a lot of mistakes done by your seniors and everybody. So they would have learned from their own patient cases. So you can even learn from the transfer cases. So what I loved was I learned a lot from the transfer cases, what I have to do and how I have to correct. Whenever I get a case, patient case, I would see how I have to apply my biomechanics to just complete the case. So by doing this, you will actually get more expertise. You're even making a mistake and then you're correcting it. It's a great thing, because when you go out, you will see so many young number of cases where the some patients will come for the retreatment, where the treatment planning would have been wrong. It would have been wrongly done by some other dentist or something, because I'm facing all these kind of patients in my practice now. So what I would advise is that you have to take risk, you have to do mistakes, and you have to learn from that. So when you're doing mistakes, you have to learn how to correct the mistakes also during the PG. Because when you're doing some mistake and you can even approach to a particular professor whom you're very comfortable with, who will not scold you or who will not take you in a wrong sense for doing mistakes. So select that kind of a teacher and you can approach them for the guidance. But I would say you can have the help of your seniors, exactly the same kind of an personality who will not scold you or you will not misguide you. So those kind of people really will help you, and choose people like that. Also, you have to choose articles and journals, and you have to choose specific articles based upon your cases. You refer those articles and see how they have done. Slowly, when you're doing this, you will get a lot of ideas popped out. New ideas will be popping out for you to do it in your own way. So when the new ideas are popped out, please do that. And if it is going wrong, it's okay. You can correct it. So when you have that confidence, yes, I will do it, I can correct it, slowly you will learn how to correct it. So when you learn how to correct it, it will be of a great help when you come out. So what you will do is, when you are doing a mistake and then you're correcting it, it's called as round tripping in orthodontics. So when you do that, when you come out, what happens is, wherever you're getting those kind of very critical cases, you will know what you should not do. That is how you learn. So these are my tips which you have to follow during your PG time, and also why you're taking orthodontics. That is actually my kind of an explanation. Might be everybody will be different. Thank you.